Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres, and if you'd like to apply to be a guest on the show, just head on over to missionmatters.com and click on Be Our Guest to apply. All right, so today I have Denny Brennan on the line, and he's Executive Director and CEO of the Massachusetts Health Data Consortium. Denny, welcome to the show.
Thank you, Adam. I'm delighted to be here.
All right, Denny. So we have a big topic today. So really, you're liberating healthcare data by making it consumer-centric, making it more accessible, increasing consent, and thinking about things like privacy. I mean, really just empowering individuals with their healthcare data. It's a big deal, big topic. I don't feel like we talk about it enough. So I'm really excited to have you on today.
Thank
But
you.
just to get us started, we'll start this episode the way that we start them all with our Mission Matters Minute. So, Denny, we at Mission Matters, we amplify stories for entrepreneurs, executives, and experts. That's our mission. Denny, what mission matters to you?
Well, Adam, the mission that matters to me is what you just described, which is a healthcare system where people are able to get the care they need when they need it from the right caregiver by knowing firsthand who is available for care, how they can get that care, and having in their hands and access to the data that enables them to make informed healthcare decisions. So that's the mission that matters to me.
Awesome. And great having you on the show to get your input on this topic. And before we go further, I'd like to maybe start a little bit further back in your career. Like, when did you get interested in this healthcare economy? I don't even know, this healthcare data economy. I don't know if that's the right term, but that's the one I'm using. But just the analytics and the idea of all of this data
Right.
out there in healthcare. Like, how'd you get interested in this?
Well, Adam, I've always been a little bit of a data geek, if you will. I started in healthcare about 32 years ago, working in consulting as well as in healthcare technology companies. And we were always working with data. We were always dealing with the fact that health data was pretty lousy when you think about it. It was aged, and not in the good sense, but old. It was incomplete. It was often inaccurate. And I found myself in whatever position, whatever role I was playing over the course of my career, confronting the fact that getting through to answers to important questions, whether they're clinical questions, whether they're operational questions for hospitals, for health plans, whether they're quality questions, is the healthcare I'm getting as a consumer worth the money I'm paying for it? Or can I get better care for less, or something that approaches more of a value basis for making healthcare decisions? And I encountered that kind of data challenge everywhere I went. So over the course of those last 32 years, I found myself sort of triangulating, if you will, to a place where I can actually start doing something about it. And at the Mass Health Data Consortium, or MHDC as we call it, we're very, very invested in a health data future where consumers, whether we call them consumers or patients or members, all those terms are tossed around in healthcare. But for the sake of this discussion, I think we should just call them healthcare consumers.
Yeah.
The idea of liberating data is important for healthcare consumers because it's their information. It may be captured by someone else. It may be sitting in someone else's system, whether it's a health insurance plan or a hospital or their primary care physician practice. But those data describe them, and frequently those data are inaccurate, incomplete. And we envision at MHDC a future where consumers are actively engaged in making sure their health data is as pristine and as accurate as possible. And that's an exciting future for us.
I think it's really exciting, and as I started this interview by saying that I don't think it's one we talk about enough, and I think that there's a big reason why it doesn't come up enough, and that is really I don't think everybody understands like why this is so important. So at the risk of asking you such a basic question, I do have to say so why is it important?
Well, it's our health, and when people look at our health data, whether they look at our health data on an electronic medical record,
Mm-hmm.
or they evaluate our health data in a care management system at a health insurance company, they're making decisions about the services we are to receive, the services for which will be approved, the diagnoses and procedures that we have experienced over the course of our healthcare lives that may be informed by wrong data. They may be informed by inaccurate, incomplete data. And it worse in some respects is the fact that those inaccurate, incomplete, aged data proliferate. And it's very hard to stop that process of data proliferation and saying, wait, we need to ratify, validate that the data that's describing an individual, their health conditions, their disabilities and accommodation needs, their socioeconomic status or their race, ethnicity, and language. We need to understand these things better, not just because we're collecting data, but because we're supposed to produce a healthcare system that is equitable, that is accessible, that is fair, and that is doing the right thing for the patient. And right now we're in a stage of revolution, if you will, in how health data will be managed, where the opportunity for the consumer to step in and be a part of making sure that their data is right, is accurate, is essential, because from there all decisions are made. And if you don't work from the best possible data, you can't get the best possible care or the best possible services to which you're entitled.
Now, I'm going to use your words here, Denny. So from the data geek perspective, all right. So what can happen when this data is wrong? So I want to give like the audience something tangible to understand, because I mean, intuitively we can all say, okay, the data is wrong, then that's a bad thing, right? But like, what can happen when the data is wrong? Like, what are some of those outputs that we wouldn't want to happen that maybe even have?
Well, there are a number of examples. One can be, for example, that if a person is identified as needing transportation support in order for them to make and meet, make their healthcare visits and fulfill, the duties that they as a healthcare consumer have and want to complete to be as healthy as possible. When we look at transportation, we often think that's because the person lives in a rural location. They need transportation support because they're far away. We find often that people need transportation support because they're disabled. They could be living very close to a T stop, as we would say in Boston, or rapid transit, or they could be able to call an Uber or a rideshare service, but their disability prevents them from even getting to the front door and out the front door. There are numerous examples where patients are delayed in their receiving authorization for certain medical services because the data that describes them is incomplete. So they have to wait weeks sometimes to get a procedure approved. And often other data can be misinterpreted because it's incomplete. And clinicians and health insurers can make decisions or come to conclusions about patients in aggregate and individually that can be quite inaccurate. And at worst, it can present clinical harm. At the very least, it makes life much more difficult for the patient or the consumer when it comes to getting the right health care.
So for that healthcare consumer, I mean, there's a lot of different variables here, obviously, but for as a system overall, I mean, there could be systemic things that are improvements that aren't, or something you can go in one direction when it should have been the other direction. I obviously oversimplifying, but if you're making these data-driven decisions that are off, because the data is wrong in the first place. And then for just quality of care, I mean, the system as a whole, the goal, I would argue, would be, we want for the reason why it's in place is because we want to increase the quality of care overall. But, from the patient standpoint, and then, all the way up above, but with the wrong data, you're off is what it comes down to.
You're off. And as a consumer, the experience with the healthcare system is pretty dreadful.
Yeah.
COVID has been really difficult, and that's understandable. That is a an act of God once in
Yeah.
a century kind of situation or circumstance that causes everything to change. But there are ongoing, pandemic independent issues that have to do with the time it takes to make an appointment.
Mm-hmm.
Is if you want to make an appointment with a new specialist physician, even if you have a referral from your primary care doctor, it can take months if you're able to even get an appointment at all. We've seen, for example, the use of telemedicine explode over the
Mm-hmm.
course of the pandemic, and people really like it. People
Yeah.
really like it. They're able to see their doctor, albeit virtually. They're able to have an appointment at a time that's convenient for them. They are freed of having
Mm-hmm.
the burden of commuting to or traveling to wherever the hospital or clinic is. So the idea that data, if it's better, if it's more accurate, can enable a consumer and the industry to be
Mm-hmm.
much more consumer friendly. Both health plans and healthcare providers, hospitals and doctors, really want to make the experience better for patients, better for
Right.
consumers. But it's enormously difficult for that when information is siloed in individual organizations. And I can't for the life of me get a quick appointment for an urgent care visit without having to go to an urgent care center that may or may not be able to help me and may still present the same problems in understanding what my situation is. So by liberating healthcare data, as we describe it, we're not talking about letting the data go free. We're talking about let consumers own, that's really a touchy term, but let consumers steward their health data with their health insurance plan, with their primary care doctor, and with the help of family members if they don't want to do it themselves, so that when they need health care, they can get it. And their experience of getting health care can be much better than it is today, which is pretty bad. I mean, we have in our neck of the woods, in the greater Boston area, we have some of the best healthcare in the world.
Mm-hmm.
And we have some of the finest clinicians. We have some of the best health insurance companies. But getting to healthcare, instead of healthcare coming to me, making healthcare much more accessible, giving me more choice when I need choice, and providing me the opportunity to have my data used as I would like to use it, helps everybody. There are too much data out there. 330 million people in this country for any one segment, doctors, hospitals, health plans, health insurance plans, to fix those data on their own. If you want to scale the major improvement of health data, you need to engage the consumer in that process, because every consumer, unlike manufacturing, where you're producing, common outputs, you're producing cars or phones or what have you, in healthcare, you're producing uniquely positive, improved outcomes in a perfect world for each individual based on their unique individual needs. If they're not weighing in, you're not going to know anything about them. And they're not going to be able to tell you enough. And they're also not going to be able to protect their information from those who might want to use it for reasons that aren't necessarily in the patient or consumer's interest.
Man, Denny, you have me really excited about data right now. I'm like, come on, where's my data? I
That's how
want
I
it. I
feel,
mean,
Adam, all the time. I try to
I'm like, I
tell
want
my
my data. Why don't I have it? I feel like most of the time, as consumers, healthcare consumers or otherwise, just consumers in the United States, we hear more about data protection when we're hearing about something like Amazon or maybe like Facebook or things like that, right? We don't talk about it for healthcare very often.
No, we don't. And what we learned from big tech, Amazon, Facebook, Google, is that our data are often used for purposes that have nothing to do with us. Our data are used to inform advertising, so advertisers can target products and services to me whether I want those products or services or not. And when it comes to healthcare, they're very sensitive data. This is the most sensitive set of information there is in the economy. A patient, a consumer, is more than likely willing to share their data for reasons that make good sense to them. They may want to share their data with a pharmaceutical company to support a clinical trial for a condition that they or a family member have. They may want to share their data with a health plan to make sure the health plan accurately represents their race, their ethnicity, their language, their disability and accommodation needs, so that they're supported by those organizations when those organizations use that information. But there's also information that's extremely confidential and very sensitive: behavioral health, substance abuse, sexually transmitted disease, and some of the data that people are talking about today when it comes to what are the social factors that impact a person's health, whether it's transportation, housing, food. There's insufficient attention paid to how personal and private those data are, and how much patients and consumers need to be able to control where that data goes and who uses it. And one sort of less sort of strident example of consumer-centric data system at its best is, if I'm a patient and I've received an opinion from a specialist that I need to have a surgery, I need to go through something pretty challenging and pretty intimidating, and I want to get a second opinion, under the current system, all my data goes to the second opinion doctor, who is going to have an opinion that's biased by the opinion of the first doctor.
Yeah.
But if, as a consumer, I say, I just want them to see my vitals, I want them to see my images, I want them to see my lab results, but I don't want to share the physician notes or anything that would bias that second opinion, that's not possible today. And we want to be able to make that possible in the future. So there are a lot of ways this makes it better for consumers, and better for providers like doctors and hospitals, and better for insurance companies. This is kind of what the new economy is. You don't work in isolation of the consumer. You bring the consumer into the economy and make them an active part of it, because of the complexity and the importance of this information and all of these data to improving the quality and lifespan of every resident in the country.
Yeah, I completely get it. And it makes so much sense when you explain it this way. And one of the things I like to do is take a complicated subject and try to make it, so everybody understands. So to me, when you describe this, especially the getting a second opinion from a doctor, and you're going to get a second opinion, but you don't want that next opinion to be biased based off the person that just read it, or that just, the first opinion you had. It's almost like your cookie setting online. You're like, okay, I don't want them to see everything. I just want this. So
That's right.
You're clicking on one box versus another, because maybe you don't want to be marketed this exact recommendation. You just want the raw opinion for that second opinion versus all of the other things, maybe that the conversations that happened prior. Am I understanding that right?
That's right. And moving data around is a problem. Data in motion is a bad thing, because when data goes from one place to another without sort of the appropriate focus on the consumer mediating those data exchanges, if you will, saying, okay, it's all right for my specialist to see this. I'm going to a PT appointment. They don't need to see my medication history. They just need to see my orthopedic results and why I'm going in there for physical therapy.
Yeah.
The thing that's really important about that is that there are so much data, it's so sensitive, and these data move in great quantities between different healthcare organizations, and that results in the replication of mistakes in the data again and again and again. I think we've all had the experience of going into a doctor's office, and the doctor reads us our list of medications, and we're like, I haven't taken that in 5 years, or I don't know how that got on the list. Why is that there? And it's very hard to get them off, because they exist in someone else's system, and when data are exchanged, they get re-replicated. So putting the consumer in there and making sure the consumer understands how their data are being used and has a considerable degree of control over what data can be used by whom and for what purposes, this improves healthcare, and it minimizes the amount of data that go back and forth that result in sort of a re-replication of errors from prior records, and more mess than any one person or any organization can clean up.
Absolutely. I want to pause here for a moment, and I want to
Sure.
actually dig a little bit deeper into the Massachusetts Health Data Consortium. So, of course,
Sure.
we know overall what you're working with, but maybe just directly, like, tell us exactly what you do.
Well, the Massachusetts Health Data Consortium, or MHDC as we call ourselves, we're really the only organization of our type in the country, though I think
Mm,
more people are starting to think about how can they do what we do elsewhere. We've been around for 42 years.
mm,
And Massachusetts has a long history of people who are, organizations who are competitors or
mhm.
who do contracts with each other. They sit on the opposite sides of the table with each other,
Yeah.
coming together to fix problems that are too big to go it alone.
Mhm,
And we were formed with that concept in mind that if you bring a community of,
mhm,
if you bring the health data community together,
mhm,
hospitals, doctors, insurance companies, regulators, state and federal, the
mhm,
associations that represent doctors, hospitals, health plans, et cetera. If you
mhm,
bring those as well as consumers all into the same room and you say,
mhm.
we have a big challenge to solve,
Yeah.
how do we go about doing it? You're much more likely to, one, share the burden. People can
Mhm.
recognize that they don't have to do this entirely on their own and risk suffering a first mover disadvantage. If
Yeah.
I do it first, I might do it wrong and then I'll have to do it all over again. But if everybody's in the room and they're figuring out, somebody else tried this and it didn't work, this is something I have never thought of, which would really solve our problems as an organization,
Mhm,
we're able to do great things.
mhm.
And so we've been doing that for 42 years. We introduced our members to the internet, which is fascinating in and of itself. I mean, we live as if the internet were with us forever, but the internet really didn't sort of become a thing until the early 90s.
Mhm.
And we were founded 15, 16 years before that. So we had to start by collecting data from all the hospitals in the Commonwealth of Massachusetts. There were 120 of them at the time. There are now half that many, which tells
Mm,
you how much the industry has changed. But we started as a data organization, and we're now even a stronger data organization.
mhm,
We really do three things with a community of members,
mhm.
and a community of of citizens. Not
Yeah.
everything we do is member only. We open our services up to people and organizations who want to learn from us.
Mm,
But we focus really on four things. One is we want to support the professional development of people who are in the health data economy,
mhm,
whether it's and personal development. How do I as a consumer learn how to control or learn how to manage, learn how to consent to the use of some or all of my health data when I've
mhm,
never been asked that question before? So one thing we do is we focus on personal and professional development. We put on a lot of webinars, interviews, deep dives into technology and data issues so people in our community can learn. The second thing we do is we do data governance services. These
mm,
are services that help health plans and healthcare providers, doctors and hospitals understand how do you meet these new regulations that are coming
mhm.
out that say thou shalt share data. And the industry is like, well, what does that mean? What do I have to share everything? Do I
Right.
have to share it today or tomorrow? What happens if it's, happens on the day after a holiday? All these
Right.
questions that some thoughtful, some not so thoughtful.
Mhm,
But, the idea is that we need to help people understand how do you go
mhm,
about creating a data economy that transitions from the siloed data economy we have now to one that is really built around the consumer. Doesn't mean
mm,
the consumer owns all their data and can walk away with it, though some people in
mm,
some cases could do that if they wanted to, I suppose.
mhm,
But it does mean that the consumer is an active steward in making
mm,
sure that their doctor and their insurance company know as
mhm,
much about them as is necessary to do good care. So we do governance services to help
mm,
organizations meet regulations and use the latest technologies to advance a much more
mm,
consumer centric data system. The third thing we do is we have a bunch of services wrapped around what we call exchange services.
mm,
We recently merged with an organization called the New England Health Exchange Network, which
mhm,
communicates electronically between hospitals and health insurers
mhm,
so that we can have a platform to put consumers in there and start communicating among all three. The fourth and final area that we have is what we call our Analytic Services. We support state-based data sets from across New England. We've recently done a partnership with the Lown Institute, which looks at hospitals and their contributions to social equity and to really high value care. And we offer that as a web-based service to organizations so that they can understand more about that, how they perform. So we're all about data from cradle to the grave. We're trying to figure out how to make it work as best as possible and how to engage, as I said, as a consortium. MHDC is a small company, but we have a big footprint. We have almost every health plan and every healthcare provider in the state and a good number of others outside the state as members of our organization. So when we want to pull people together and say, we have a problem to solve, or when they come to us and say, we have a problem to solve and we want you to help us, we're in a very good position to do that. And we have the expertise, we have the experience, but we also do this as a collaborative effort. We're not trying to we're not on the side of providers, doctors and hospitals and against insurers or vice versa. We see them as all part of the health data economy. And we recognize that if they get better at focusing on the consumer, focusing on the patient, focusing on the member, they get really good at that and create really compelling digital front doors where patients can get the services they need when they need them without having to go through the incredibly difficult process that's in front of us today. We can walk away from that probably long after I'm gone, but we can walk away from that and say, we've really helped to make healthcare better. So that's really who we are.
It's a great story. It's a great story, and in decades in the making, of course. I'm waiting to see the documentary on this one if it doesn't exist yet. It's a great story.
That's a good idea. We have to find a producer and we have to get some money to do it, but it would be fun.
So I wanna tackle the next question maybe from two different angles, and it's basically this. So, like, what has been the response? And I know, there's two different sides of that equation, maybe, because there's the patient side of it or the healthcare consumer. And then there's also, of course, the actual healthcare providers, that, let's just say, that whole ecosystem, the whole network of people, of members, we'll say. Like, what has been the response just overall to the work that MHDC has been doing?
I think there are two of them, two responses. One is, thank goodness you're here. Thank goodness we can all do this together and not toil.
I get that feeling, by the way. I get that feeling because it's an enormous task. Like, just the fact that you said the amount of individuals in the state and some out of the state that are a part of this, it's a monumental task.
It's a monumental task. The healthcare is large enough to be the fifth largest country in terms of gross domestic product than, given the size of it. And it's really grown over COVID. I mean, expanded even more. So we're kind of bumping up against the $5 trillion mark at some point in the not too distant future. But I think the two responses are thank goodness we have a consortium. We know and have worked with the people sitting around the table, and we can do together what we can't do alone. And I think we're very proud of that. We're grateful to have our community value us that way. There's a flip side of that, and sometimes it comes out of the mouths of the same people who think we're wonderful, and that is, this is an enormous burden. This is a very difficult thing. We don't like it. We think there are too many regulations. We think the industry is beset by the enormous burden and cost of moving from an enterprise data model, where if I can get all my data and I can do what I need to do as an organization, I'm in good shape, to an economy where data is worthless. Data in and of itself is worthless especially if it's incorrect, it's incomplete, it's out of date. So we know that this is a huge burden for hospitals, for doctors, for insurance companies, to make healthcare much more like a consumer industry. We don't know how much healthcare, we don't know anything about pricing. in
Yeah.
healthcare. And there's legislation to make pricing transparent so that hospitals and insurance companies and doctors can present to a patient, before we send you down this road, we want to tell you how much it's going to cost and what kind of choices you have to make, which is enormously important to consumers because many of them are on very high deductible health plans. And if they can save thousands of dollars by making a slight change in the course of their care in consultation with their physician, that's a very consumer winning thing. That's something that consumers like. To make healthcare prices transparent, however, is an enormously burdensome and difficult change. Now, my response is doing it the way we do it today is enormously burdensome and difficult. And the industry is going to lose consumers. They're going to go elsewhere. They're going to go to entrepreneurs who set up alternative delivery systems and alternative insurance systems because the old-fashioned ones do a crappy job. The last thing I would say is we try to find that middle ground with them and say, look, all good solutions are hybrids. This doesn't have to happen tomorrow, but it does have to happen. So we can work with you to chart a course. What things need to be done first? How can you work with others so that you don't suffer alone in doing this? And how can we comment on federal regulations to make sure that the needs of our community are understood and that we don't try to do too much at the same time? But there's a lot going on, Adam. And, going from the old health data economy to one that's much more 21st century, much more modern, is a wrenching change for the industry. And it's going to take a long time. But everything takes a long time in healthcare. And it's much better than doing it the way we've always been doing it. So we try to find that middle way between you have to do everything and it's a big burden, we know, but we'll help you. And don't bother, it's too problematic, it's too difficult, by saying there are steps we can take to make the path easier and less, less treacherous than it sometimes feels to our members across our organization, across our community.
Yeah, it's just an amazing time in healthcare. Like I mean, every day I'm interviewing somebody from that entire pipeline that you mentioned, whether it's the entrepreneur that has an alternative system or model, or it's a larger group that has something that maybe they're changing, or in your case with MHDC, something established 40 years, and this Herculean task of trying to change and do your part of liberating healthcare data. So I just think it's an interesting time, and I'm glad that I just get to ask the questions and you find the answers, and that a lot of very intelligent, smart, and driven and passionate people like yourself are out there working on this problem, because we have one thing in common, and that is all of us do, is that we're aging, right? Day by day, we're all getting a little bit older. We're all aging, and it's possible that we're going to be leveraging and using the healthcare system in one way, shape, or form in the future, more so than we had in the past, just by the nature of aging. So I like you out there working, Denny. That's my long story short on that one.
Thank you, Adam.
So
I
have
appreciate
to
that.
ask, so what's next? I mean, what's next for you? What's next for the MHDC?
Well, what's next for us is we're working on a couple of projects that are designed to help our members and the health data community, navigate this difficult and burdensome path a little more easily. All of us have had the experience of going into a doctor's office and the doctor saying, well, you need to have an MRI, or I need to prescribe you a drug. And we have to go through this thing called prior authorization, which is basically the physician has to reach out to the health plan, find out whether or not the service or drug or test that they prescribed requires prior authorization. And then they have to go through this back and forth, usually by fax and phone. I mean, this is a very old-fashioned, very burdensome, tedious thing. Some organizations have gotten very good at doing it. All organizations hate it. Patients hate it. Physicians hate it. And even health plans don't like it, because the benefits of forestalling paying for things that are not necessarily best for the customer, for the patient, is a bad place to be. And if it's happening more and more, it creates difficulties for everybody involved. So we're standing up a prototype of automated prior auth. prior authorization, so that if I walk into a doctor's office and the doctor starts looking at the electronic medical record and says, I think we should look at getting an MRI, and they type it in, they can find out, reach out to the health plan, secure the necessary information they need from the health plan, send back the information that the health plan requires, and get an approval almost instantaneously, instead of people picking up the phone or sending faxes. So that's one thing we're looking at. And the reason we're excited about that is because prior authorization is a very burdensome and painful thing, especially for doctors and patients. And it can delay very needed care. And what we see in getting a scenario, or as we call them, a use case like prior authorization, automated to this level of detail, this level of immediacy, instantaneousness. If we could do that for something as complicated as that, we can do it for anything. Wow. So by putting in the network and the rules and the standards that enable real-time prior authorization to occur, we enable a whole lot of other things to happen. We enable price transparency that we were talking about. That gets easier. And this follows along what I said earlier, is we don't have to do all of these things as if they were individual, huge, monstrous problems. If we do one of them really well, that carves out a piece of difficulty from the second one, and that carves out a piece of difficulty from the third. So by working on prior authorization and automating it, we are excited about the fact that this puts in a network and a set of standards and a set of communications protocols that will be used for anything else. It's kind of like, putting in the railroad tracks so that, to do one thing, to get to get a train to go from one part of the state to another. But once you've laid all the railroad tracks, people can go wherever they want, and they can do a lot of things that they weren't able to do before. They could ship products, they could travel, they could do all sorts of things. But just by putting in the tracks to do one thing that's really to alleviate burden in one area, we're actually alleviating burden across a lot of areas and replicating a good way of doing things in a number of other use cases that currently are just as hard and just as difficult to do and could benefit from that.
Wow. It's really exciting. It's really exciting work. And if somebody's watching this and they want to learn more about MHDC, follow the journey, get involved, I mean, like, how can people do that?
Well, they can reach out to us at info@mahealthdata.org. That's Ma as in Massachusetts, health data, all one word, mahealthdata.org. And we'll follow up right away. Those messages go to me. So I'm going to follow up right away. And we're always thrilled to hear from community, whether it's local, regional, national, or international. So I would recommend info@mahealthdata.org. And you can learn how you can be a part of our community at a level that's good for you, from free to going whole hog. It's up to you. So we're eager to build our community and to help people make the health data system better.
Fantastic. Well, Denny, it really has been a pleasure having you on the show and just learning more about MHDC, what you're doing. I mean, working for all of us out there, really creating the model, and it's just really interesting.
Thank you,
to
Adam.
me, and I'm excited to bring it to the audience. And speaking of the audience, if this is your first time with Mission Matters, we're a platform that's all about bringing on entrepreneurs, executives, experts, individuals out there that have a passion and have a mission that they're out there making a difference with in the world and in the marketplace. Things that are inspiring, like disruptors, all kinds of content there. If that's the kind of information that you're into or that excites you, we definitely welcome you to hit that subscribe button, because we have many more mission-based individuals coming up on the line, and we don't want you to miss a thing. And Denny, really, this has truly been a pleasure having you on, and I'll be keeping a lookout for that documentary.
All right, Adam. Thank you very much. Good to talk with you.